Hello, everyone. Thank you for tuning into this channel. My name is Gianji, and you are watching Health Talk with Gianji. If this is your very first time tuning in, I thank you so much, and I want to say welcome again. So, in my last video, I discussed some important things that you should know about kidney disease. So, today I will be talking about treatment options for kidney failure and sharing some important facts that I think you should know. That's important for you to know. So before getting into our video, no copyright to any of the images and music in this video. This is for information purpose only and does not constitute professional medical advice. Neither does it form any professional relationship. So if you or anyone watching this video has a medical issue or concerns, please do contact your healthcare provider for further instruction. That being said, let's get into our video. So being told that you have kidney failure can be very devastating, and it's a news like any other disease or illness that nobody wants to hear. This is a life-changing event. So if you are out there, or maybe you know someone living with chronic kidney disease, or maybe it is yourself or a family member, it is important that you start getting informed of the treatment options that are available to you if for some reason down the line you do end up with kidney failure. So the objectives for this video are as follows. I'm going to be giving a list of the different treatment options. I will be giving you a brief description of the treatment options. I'm going to be talking about, when is a good time to start having this discussion with your doctor about the options that are available for you. And then my last slide will be references that I use to put this video together. There is no cure for kidney failure. This is also called end-stage renal disease or end-stage kidney disease. When your kidneys stop working, you will not be able to live or survive without getting treatment. However, many people can live longer with treatment. So when it comes to treating kidney failure, you have certain options available to you. Now, these options are dialysis, kidney transplant, or medical management. So the first option I'm going to be talking about is dialysis. But it's important to know that when you are deciding what treatment option is best for you, it's important to talk to your doctor about which option will fit into your lifestyle. Now, your lifestyle will be whether you are working still, if you are working full time, if you're going to school, if you're active. Outside of your life from home, like if you are active in your church or in the community, those are important things that you want to take into consideration when you are deciding what treatment option is best for you, because you want your dialysis treatment to fit in with your lifestyle and not the other way around. So what is dialysis? So dialysis is a process that helps remove waste and extra fluids from your body. Now, there are two forms of dialysis. The first one is hemodialysis, and the other kind is peritoneal dialysis. Let me see if I can get this pointer to work, and I can show you. If you see in the pictures below, the first diagram here, just follow the red dot. This is a form of peritoneal dialysis. In the middle here is hemodialysis, and then the last picture down here is another form of peritoneal dialysis that we're going to be talking about later on in this video. So talking more about hemodialysis. So first, when you hear the word hemo simply means blood. And hemodialysis is one type of treatment for kidney failure. So you will sometimes hear your kidney doctor or other healthcare providers call a hemo. It uses a machine, and with this type of treatment, blood is moved from your body and it travels through tiny tubes that look like straws into a dialysis machine. So the machine has a filter in it that is called dialyzer or dialyzer. So when your blood is in that machine, the filter cleans your blood by removing the waste and extra fluid. Then the clean blood travels through the tubes from the dialysis machine back into your body. So before you start hemodialysis, you will need to have a minor surgery to create what's called a vascular access. So this access will allow your healthcare provider to be able to enter your blood vessels. And this is how your blood will flow in and out of your body to the dialysis machine. Now, like I said earlier, okay, so there are two types of hemodialysis. So there is in-center hemodialysis, and then there is at-home hemodialysis. So just to compare the two, if you take a look here on the left-hand side, is hemodialysis. So I'm just going to be comparing and giving you a little bit difference between in-center hemodialysis and at-home hemodialysis. So when you hear in-center hemodialysis, it's simply treatments that are done at a dialysis center. It requires longer treatment times on the machine, generally 4 hours. It may sometimes you can be 3.5, but most cases starting off, you start off at 4 hours on the dialysis machine. Um, and it's usually the dialysis staff will be performing your treatments for you. So you need to schedule your dialysis treatment around your social life, your school, or work. So with in-center hemodialysis, there's stricter restrictions on fluids and food. So there's a lot more strict restriction on limiting certain foods that you eat and limiting the amount of fluid that you drink per day. So this will require you to visit a dialysis center 3 times per week. So the schedule is either Monday, Wednesdays, and Fridays, or Tuesdays, Thursdays, and Saturdays. Now, comparing it with at-home hemodialysis, these are treatments that are done in your home around your life. So there's less treatment times on the machine, and you and your care partner will be trained to perform your treatments. So this form of hemodialysis allows you to keep your social, your school, or your work life because you're gonna plan it around your what's convenient for you. With at-home hemodialysis, there's more frequent dialysis, so there's less restrictions on foods and drinks. And then there's also fewer visits to the dialysis center. So moving on to peritoneal dialysis. With this type of dialysis, your blood is cleaned almost naturally by using the lining of your belly or your abdomen, which is called the peritoneum. So if you look at my diagram here below, it's space right here. The diagram on the left-hand side, that is your peritoneal cavity. If you look on the right-hand side, this is what it looks like internally. This is your peritoneal cavity right in this area. So what happens in PD, a cleaning solution that's called the dialysate is sent into your peritoneal cavity through a PD catheter. Again, if you look at the diagram on the right-hand side, this here from down here all the way here is your peritoneal catheter. It comes out through your belly. Again, the diagram on the left-hand side, this is your peritoneal dialysis catheter. So the solution sits in your abdomen for a period of time that's set by your doctor, and this time can run anywhere from 1.5 hours to 2 hours. And during that time that the solution is sitting in your abdomen, it's absorbing all the waste and the toxins from your body through tiny blood vessels that are in the peritoneum. And this fluid is then drained out and discarded. So this type of dialysis can be done in the comfort of your home. It can be done in any private clean area, whether at work, a friend's house, or neighbor or relative house. So PD does not require any needles and your blood never leaves your body. You will be trained on how to do your own PD or with the help of a partner. But it has to be done every day, so there is less restriction on foods and fluid. Now there are two types of peritoneal dialysis. So the first one here is called continuous ambulatory peritoneal dialysis, or CAPD. And then the other type of PD is continuous cycling peritoneal dialysis, or CCPD. So with CAPD, it does not require a machine. It's done by gravity. This is the setup that you will see down here. It requires you to do 3 to 5 treatments daily, and each section takes about 30 minutes. Now, on the other hand, with CCPD, it does require you to use a machine, which is a cycler. And with this type, you're going to be doing dialysis every night, and each session takes place about 8 to 10 hours as you sleep. So the cycler continuously does the cycles of dialysis treatment as you sleep. So the next option is kidney transplant. For this type of option, it does require you to undergo surgery to get someone else's kidney. So now the kidney may come from a deceased donor, meaning if somebody dies, or a living donor if you have a friend, family, or a friend who's willing to donate one of their kidneys to you. Now, the disease, if you receive a kidney from a deceased donor, that kidney generally lasts about 10 to 15 years on average, versus if you receive a kidney from a living donor, that kidney generally lasts for about 15 to 20 years on average. So this option, which is the kidney transplant, is considered the best treatment option for kidney failure. It also increases your chances of living a longer, healthier life. So lastly, the last option I will be discussing is medical management. So there are cases where some people may choose to start dialysis, and after some times they will decide that they don't want to do dialysis any longer for, one reason or the other. So medical management is simply making you comfortable in treating any symptoms that you may have until your body can no longer function, which simply means you die. So if you are asking how long you will have to live if you choose medical management, there's no definite answer because it depends on many things and everyone is different. You and your doctor can work together to keep you as healthy as possible. Okay. So when you do decide to choose not to receive dialysis or not to get a kidney transplant, medical management helps you live comfortably until your body can no longer function. So it will not keep you alive, and it's not a treatment for kidney failure. So some comfort measures or treatments that is included in medical management will be medications to treat your high blood pressure, medication to relieve swelling, treatment for anemia, medication to treat to lower your cholesterol levels, medication to protect your bones, to lower protein diet to minimize waste products in your blood. So these are just some examples of comfort measures that are used if you do decide to choose medical management to treat your kidney failure. So if you are asking when is a good time to discuss these treatment options with my doctor? Again, there is no treatment for kidney failure, but many people can live long lives on dialysis or with kidney transplant. So your doctor can help you decide which treatment is best for you. So if you have any risk factor for developing kidney disease, like someone in your family has kidney disease, or if you yourself have high blood pressure or diabetes, or have had diabetes during pregnancy, your primary doctor should be monitoring how your kidneys are working. So this is a simple blood test to check how well your kidneys are filtering your blood, and this test is called checking your glomerular filtration rate, or we would say GFR. So it is recommended to start discussing your treatment options with your doctor when when you are in stage 3, which is your GFR is between 30 to 59, and that's considered moderate decrease in your kidney function, and it's stage 3 chronic kidney disease. So you want an option that fits best with your lifestyle, like if you work, you go to school, you like love traveling, you meet a care partner, or if you have young children. So it's good to discuss these options earlier so you can be able to plan better. So the right treatment option will help you stay committed and improve your overall health outcome. So this brings us to the end of this recording. Thank you again for watching, for tuning in. Uh, I hope this was helpful. Please feel free to leave any comments, subscribe, like, and share this video with your family, friends, and loved ones. Be blessed and stay safe until next time.